The Stork kit contains two main parts, the applicator and the conceptacle. Within the applicator, there are 4 activation components: the cap holder, button 1, 2, and 3. Step 1. Wash your hands thoroughly. Remove the conceptacle from the package. Do not use fingernails or anything that can damage the conceptacle. Pinch the tip of the conceptacle gently so the majority of air is not trapped inside. Hold the tip while you unroll the conceptacle all the way to the base of the erect penis, just like putting on a standard condom. Step 2. Natural intercourse. Step 3. Wash your hands thoroughly. Remove the conceptacle by re-rolling the condom to the cervical cap. Ensure the cap stays upright to prevent spillage of semen. Separate the cervical cap by pulling outward on the condom roll while pushing upward on the outer rim of the cap. Always hold the cap upright, touching only the outer surface. Extract the cervical cap, keeping it upright. Step 1. Remove the yellow shipping wrap by pulling on the tab. Place the cervical cap into the open cap holder as shown. Ensure the cap is in place. You will know the cap is in place when the rim of the cap will rest evenly on the ridges of the 2 petals of the device. Do not squeeze the outer petals to close the cap holder. Gently squeeze the cap holder closed until you hear a click. Keeping the applicator upright, pull back on the applicator's plunger tab with the raised single dot until the plunger stays back on its own. You will feel a slight resistance. Hold the stem firmly while pulling back on the rear plunger tab until you hear a click. Keep the device upright. Do not tilt the device more than 45 degrees. Step 2. Insertion is best done in a reclining, supine position as shown. Use pillows for support. Make yourself comfortable. Holding the applicator as shown and using no lubricant, introduce it into the vaginal tract, sliding gently until the tip reaches the cervix and you can no longer advance. Do not continue to force the applicator into the vaginal tract if excessive resistance is felt. You may feel slight pressure as the cervical cap meets the cervix, but you should not feel discomfort or pain. Release the plunger by depressing the release button with 2 raised dots. You will hear a click. While keeping the applicator against the cervix, depress the plunger to open the cervical cap. This allows the cap to be opened at the cervix and also allows you to make final adjustments prior to releasing the cap. Step 3. Release the cervical cap by depressing the cap release button with 3 raised dots. Remove the applicator. The removal string is now exposed. The Stork allows you to continue with normal activities. Get out of bed and have fun. Do not have intercourse again until you've removed the cervical cap. Step 4. After 4 to 6 hours, remove and discard the cap.